Welcome to the Hertfordshire Family Centre Service Oral Health webinar. This webinar has been created in collaboration with Family Support Service, Public Health Nursing and School Nursing. So before we have a look at the sugar content in some of our favourite snacks, let's have a think about the different types of sugars. Milk, fruit and vegetables all contain sugar, but these are sugars found naturally within these foods. We don't need to avoid this type of sugar, and they are not included in our recommended amount. Refined sugars are the sugars that are best to avoid. These are sugars that are added into foods. So, bearing this in mind, let's think about some of the snacks we eat and their sugar contents. Have a look at the picture below and see which you think has the highest sugar content. Is it the strawberry and banana smoothie, the raisins, or the iced donut? When you look at your food packaging, they will give you the sugar contents in grams. 5 grams of sugar is the equivalent of 1 teaspoon of sugar. You may be surprised by the results to see that the smoothie is the one that contains the most sugar. The donut contains 3 teaspoons, the raisins contain 2, while the smoothie contains 5. Let's have a think about this a bit more. The sugars found naturally in fruit and vegetables are less likely to cause tooth decay because they're contained within the structure. We do not need to worry about these types of sugars, but surprisingly, when fruit and vegetables are juiced or blended into a smoothie, the sugars are released. Once released, these sugars can cause tooth decay. Limit the amount of fruit juice in smoothies to a maximum of 150 ml or a small glass in total per day, and drink it with meals to reduce the risk of tooth decay. So we'll have another go. This time we have a small children's yoghurt, mandarins in fruit juice, and a packet of dried fruit flakes. Which do you think will have the highest sugar content? So this time it's the mandarins in fruit juice that contain the most, with 3 teaspoons of sugar. But these are natural sugars from the fruit, so not as bad as it sounds. Avoid fruits and syrups, as these are not good for your teeth. The yoghurt has just under 1 teaspoon, and the dried fruit flakes contain 2 teaspoons, but is sticky and can get stuck in between little one's teeth when eaten on the go. So it is always worth checking the sugar content on your food packaging, as sometimes you may be surprised, and many foods are quite cleverly marketed. To prevent tooth decay, avoid snacking on sugary foods and drinks, such as sweets, chocolates, cakes, biscuits, sugary breakfast cereals, jams, honey, fruit smoothies, and dried fruit. By limiting these to meal times, you can reduce the amount of damage they will do to your teeth. Remember, eating low sugar alternatives, for example a reduced sugar cereal bar, will cause the same damage to teeth as a full sugar equivalent if not kept to meal times. Teeth can manage with some sugar throughout the day, but keeping it limited to meal times can prevent tooth decay. Have a look at our frequently asked questions for some more friendly snacks for your children. You should start brushing your child's teeth as soon as they first appear. Teeth brushing needs to be supervised until at least 7 years old. Most babies get their first teeth at around 6 months, but they can arrive earlier or later, and when they do, that is the time to start brushing their teeth and making their first dentist appointment. You only need a smear of fluoride containing toothpaste until your child is 3. After that, a pea-sized amount. From age 7, choose an appropriate fluoride toothpaste. All toothpaste have the ages clearly marked on them, so you don't need to worry too much about the brands you choose, but it is important to ensure you have the correct age group and that you're using the correct amount. Toothbrushing should happen twice a day, in the morning and before your child goes to bed. A good tip: the last thing to touch a child's teeth before going to bed should always be their fluoride toothpaste, and not milk or a drink. You want to ensure that this is done at least 20 minutes after they have eaten. If your child is going to have milk or a drink of any sort, please do this before brushing their teeth, as you want the fluoride to remain on the teeth after brushing and for no further sugar to enter their mouths. Toothbrushing should be for at least 2 minutes. Look out for some fun ways to support this. This can seem like a long time, particularly for children, so there are many ways you can make this fun, and we'll look at this later in our webinar. So, just to recap on some of the key points for you to remember. Current advice is not to rinse after brushing. Rinsing after toothbrushing removes the fluoride from the child's tooth surface and removes the protective benefits. This includes drinking water shortly after brushing your teeth. Watch what they eat. Remember our examples here of sugary foods and check food packaging for sugar content. Nearly all packaging has the traffic light system, so it's visual and easy to see what products are high in sugar. Remember though, these labels will include added sugars, so the ones to avoid, but also the natural sugars found in milk, fruit and vegetables. So if it appears high, but these are fruit and vegetables are still in their natural form and haven't been juiced or blended, they aren't foods we need to avoid. Have a look at NHS Food Scanner app, where you can scan products in the shop to find out what sugar is hiding inside. NHS dental treatment and advice is free for babies and children all the way up until they leave full-time education. Take your child to the dentist when their first tooth appears. This will help them to become familiar with the environment and to get to know the dentist. And did you know you can also get free NHS dental treatment and advice if you are pregnant? There are various children's songs on YouTube or apps for phones that are fun for children and last the expected 2 minutes of teeth brushing. Favourite toys can also be included in the routine. If your child takes a toy to bed with them every night, perhaps Teddy's teeth can be brushed for 2 minutes first, and then Teddy may want to help brush your child's teeth for 2 minutes. There are also lots of books that support why teeth brushing is important. Your local library is a great resource where you'll be able to borrow books for free, and when your child's first tooth comes through, ensure you collect your child's first tooth certificate from them too. Visit the Start for Life website below for more ways to make food shopping fun. Fresh fruits and vegetables can be costly. Some families may be entitled to Healthy Start vouchers to help pay for these items. To find out if you qualify and to apply online, please visit www.healthystart.nhs.uk. If you have an older child who is beginning to ask questions about their teeth, they may like to sit with you to look at these next couple of slides together. It's really important we look after our teeth so we're able to eat a variety of healthy foods. To be able to eat hard foods, like the apple in this picture, this is only possible with strong, healthy front teeth. Your teeth are a very important part of your child's speech and language development. We need our teeth to correctly form our letter sounds. Front teeth are sharp for biting our food. Back teeth are wide for chewing our food to make it easy to swallow. 11% of 3-year-old children have experienced dental decay despite having their back teeth for between 1 to 2 years. Tooth decay is the most common reason for children under 10 to be admitted to hospital for tooth extraction. Start visiting your dentist as soon as your child's first tooth appears. To help get your baby familiar with a dentist, you can take them along to your own dentist appointment, where most dentists will be happy to have a quick look inside baby's mouth whilst they sit on your lap. Talk to your child's preschool, nursery or childminder about fun ways to encourage visits to the dentist and how they are promoting good oral health in the setting. Ask your dentist about fluoride varnish. It's free for your child up till the age of 18 years old. Fluoride varnish may be offered to you when your child visits the dentist. Your child cannot eat or drink for an hour after it has been done, but it adds an extra layer of protection to their teeth. Speak to the Family Centre service about finding a local NHS dentist or a pop-up dentist in your area. Please scan the QR code to find your local NHS dentist. The Family Centre service can help you by offering a free toothbrush pack for children entitled to 2-year free early education or receiving targeted support. If you wish to receive this pack, you can call the Family Centre on the 0300 123 7572 number, where our administrators will be happy to assist you. Speak to your health visitor or the Family Support Service on the 0300 number about coming along to one of our small groups, such as Little Chefs or Little Learners, if you have concerns about your child's diet or development. Come along to groups offered by the Family Centre Service to get more information about infant feeding, introducing solid foods, and planning a healthy diet for your child. You can visit our website at www.heartsfamilycentres.org for what's on in your area. Please have a look at our frequently asked questions to explore this topic more.